I'm Eric Barnes with the Daily Memphian, and welcome to The Sidebar, a weekly show on the community, arts, culture, and more. Today we're talking with Pedro Velasquez of LifeDoc, so stay with us for a conversation with Pedro. And also a special thanks to our sponsor for The Sidebar, Treasement Manor. Pedro, thanks for being here.
Thank you for having me.
So let's start for folks who don't know what LifeDoc is, what it has been since, I think, founded by your father.
Yep.
And we'll start talking about some of the transitions and changes and evolution that are going on. But just for those who don't know what LifeDoc is.
So LifeDoc was a way for my parents, both of them in 2005, to give back to Memphis for what they did for my family and I. You know, we landed here in 97 from Venezuela because of St. Jude. I was lucky enough to be a patient there for 5 years. And, you know, at the end of those 5 years, we were stuck between, you know, are we going home or are we staying here? And my father had been doing research at UT and had found what's going on in Memphis in terms of healthcare status of Memphians. And what he saw was pretty scary in terms of, you know, the prevalence of conditions like hypertension, diabetes, and cardiometabolic conditions, and the rate at which they're happening in kids. And so he saw an opportunity to stay in Memphis and make a difference. And so him and my mom opened the clinic in 2005 as a primary care center.
And I should note that we are in the 10th floor of the Central Atrium in Crosstown, and the music has started. We figured out that they play every Tuesday when we record the Sidebar, even though it airs on YXR on Thursday. So if you hear the music in the background, it's just there to make us feel happy. So your father's a doctor. Was your mom a doctor? Is a doctor?
They were both physicians. My father, an endocrinologist, my mom, a radiologist. They did their fellowship at Harvard and then went back to Venezuela to, you know, apply what they learned.
Yeah.
And so coming to Memphis wasn't necessarily part of the plan.
Right.
Yeah.
Right. We'll circle back to some of that. But so LifeDoc now, you joined what year as executive director?
I joined as volunteer for the first 10 years of the clinic, functioning.
Okay.
During my college years, I was in Miami, and, you know, during the summers, I'd come in and help out at the clinic. And then my junior year, things were a bit difficult, so I stayed to complete my senior year from Memphis.
Okay.
And that's where I found, you know, a calling, I guess, to work in healthcare and really, try to make a difference based on what I was doing at the time.
Not as a doctor, just to kind of get the lay of the land, but
correct.
And so now you are executive director.
Yeah, so now I'm an executive director as of 2021.
Okay.
When we transitioned to nonprofit.
Okay.
But, you know, I started as, like I said, volunteer, free child labor. Then I went into front desk and then got into billing and different aspects of the healthcare operation so that I could, you know, and then I got really interested in trying to see how do you use that to drive where healthcare should be going to instead of just repetitively doing the same things that have gotten us to where we are today.
And you'll do a certain amount of, and you'll define this better than me, but a certain amount of direct care of patients, a certain amount of research. I mean, part of the mission is not there's anything wrong with this, but not just to provide care, but to do research and try to find best practices and so on that can be shared with others. Is that a fair way to say it? Or
yeah, it's very practical research, right? Is what we're doing working? And if it's working, how can we get others to do it? And so we publish everything we find. We've always been very data driven. So even though we started as primary care, you know, the more we learn about Memphians, the more we try to do. So we added endocrinology, health coaching, diabetes, cardiology, optometry, pharmacy, behavioral health. And as we've added these services, it's based on what does our patient and what does Memphis show that it needs and how can we do this sustainably. So even though we transitioned to nonprofit, we haven't abandoned our concept of self-sufficiency.
Yeah.
And so our whole thing is, you know, we want others to do what we do. So a lot of the biggest hospital systems certainly in Memphis are all nonprofits as well, and certainly generate lots of revenue and are in their way sustainable. But how many people do y'all serve every year? We see about 12,000 patients a year, maybe provide about 50 to 55,000 visits depending on the year. because our biggest thing isn't going to be to be the only ones doing what we do. We don't need to be the biggest. We just need to find what works and then help show others what they can do to implement this in their own organizations.
Examples of that, of things that y'all have found and that you've been able to share and you think you've made an impact beyond the walls of LifeDoc.
So a lot of what we do is obviously, try to see three fundamental things. What do our patients show they need? What can we do about it? And is it sustainable? Because for others to do it, it has to be more than just an article that says, oh, nutritious education helps people live healthy. But like in a practical sense, a provider needs to know, how can I pay for these things to happen? How can I support these services to be rendered in my facility? So a lot of what we do is, work with the state, work with the insurance companies, with pharmaceutical companies, with the universities to see what has to happen in each part of this ecosystem, I guess, for these services to be accessible and delivered.
How many, apologies if you said this, how many locations do y'all have?
We have 3 clinics and we're in 5 schools.
Oh, okay.
Yeah. And so those 3 clinics, we just opened up our most recent location at Lenox Park. It's a 30,000 square foot multi-specialty facility. And so, over there is where we apply a one-stop shop concept where, instead of taking multiple days off work or school to go to all these different services right across town, we're trying to make sure we can provide convenient and accessible care.
I mean, that's not to blow this out of proportion, or maybe this is a mistake, but that was the whole Mayo concept, right? At a high level, Mayo Clinic was like, hey, you come, you go through, you see every specialist, and we try to get to the root of what's going on with you, generally focused on very, very serious conditions or even rare or kind of no one else could diagnose it, but Mayo could. But I've known people who've gone there and they said it is just remarkable because you do see all these specialists over the course of a day or 2 or 3. So you're doing a version of that?
It's an exact comparison. I've used it myself a lot of times, not just because Mayo started with a physician whose 2 sons, took over, and then it became from a private practice to a nonprofit and what it is today. Yeah. It took, over 100 years. And then Robert Waller, who was the CEO at Mayo, was also an ex-mentor of mine and, someone who I picked his brain up.
And he was from Memphis, or is from
He
Memphis.
Wasn't from Memphis, but
he
he ended
Memphis
up
connection.
here.
That's right. Okay,
his
there
wife.
we go.
And then he got very involved with the Southern College of Optometry. And
That's
right. Very involved with Memphis in his later years.
Again, we're talking to Pedro Velasquez from LifeDoc. The shift to a nonprofit changed a lot, a little. Was it coincide with other shifts in the sort of mission and purpose?
It put us into, a different level, a different speed, a different gear, I guess. We became a nonprofit in 2021, but we had started the process in 2019. And, when you're switching a for-profit to a nonprofit, the IRS asks a lot of questions.
Right.
And so it spent 2 years doing it. And when we finally launched, we scaled at a much faster pace because, it also lined up with COVID where a lot of practices shut down because they couldn't stay open by being, shut down during COVID.
Right.
And so Memphians were left without a medical home. We were asked to take on a larger population. And so we had to sort of move at a different pace since becoming a nonprofit. But it's also useful because we've been able to, create strategic partnerships with people that, we didn't.
You wouldn't have been able to. Yeah. Are you focused on the uninsured? Are you is it an all-comers? Are you like, what is the focus of the patients that you guys see?
So we see all walks of life. We're trying to maintain the fact that, for health equity to be equitable, it has to be accessible no matter of the socioeconomic status. So that means that some of the most affluent people in Memphis come get seen, and some of the lesser so also come get seen, but they get the same standard of care. We were talking earlier about some mutual connections, and they were patients at the clinic, and that's how I met them. So that's not typically what you see in a nonprofit that's serving the underserved. So 90% of our patients are Medicaid or uninsured, but the other 10% is people with diabetes, hypertension that we need to make sure has access to the best care possible.
Yeah. We'll come back to all that. I want to stop and just do a little bit of housekeeping. Again, we're talking to Pedro Velasquez. He is executive director of LifeDoc, and we've got a bunch more questions for him. But I'll remind everyone, I'm Eric Barnes. This is The Sidebar. It airs here on WYXR 91.7 every Thursday at 11:30, focused on the community, arts, culture, everything in between. It's one of many weekly podcasts we do at the Daily Memphian, including the Memphis Grizzlies podcast and our food podcast, Soundbites, that are hosted by Chris Harrington and Holly Whitfield. Soundbites and The Sidebar, again, they air as podcasts on Daily Memphian, but also on WYXR. Soundbites comes on at 11. Sidebar, there's too many S's, Natalie. The Sidebar comes on at 11:30. All of our podcasts are on the Daily Memphian site, as well as iTunes, Spotify, wherever you get your podcasts. I mentioned WYXR. WYXR is also a nonprofit listener-supported radio. Just had its spring pledge drive recently. If you didn't give then, you can give now and become a member. Get all kinds of member benefits. Go to WYXR.org or WYXR app, wherever you get your app. And you can donate, you can get past shows, you can get past music shows, archives of everything, and learn more about WYXR. I should also mention the Daily Memphian is a nonprofit, the largest nonprofit. Well, it's the largest newsroom in the Memphis area, and very much supported by your paid subscriptions. So if you're not a paid subscriber to the Daily Memphian, to consider becoming one. Recently on The Sidebar, we had Philip Ashley of Philip Ashley Chocolates. We had Stephanie Ferreira with Vintage 901 and the cool food and wine stuff that they do. We also had Lauren Kennedy, longtime head of Urban Art Commission, who in December started her own gallery, Sheet Cake Downtown. I have hosted Behind the Headlines for 13 and a half years over on WKNO. We have recently had on Bill Hargrave, the U of M president. We had Robert Connect after a bit of a timing mix-up, the head of public works for the city. And coming up soon, we've got the new Memphis Shelby County Schools Superintendent Marie Fagans. Do we know it? Is it Fagans? I pronounced it correctly. This is just a remarkable moment in the history of The Sidebar. But all those are available at WKNO.org. They're available on the Daily Memphian site, and all of those are also podcasts, so you can get those on the Daily Memphian site or wherever you get your podcasts. But we are still here with Pedro Velasquez, the executive director of LifeDoc. One of the things when I was kind of researching, you guys have, and you've mentioned it, talking about obesity and that kind of origin story that your father and mother, when they were founding the clinics, and you've broadened the things you all focus on. But right now the whole country, is it the whole world? I don't know, is in this crazy change with Ozempic and the whatever they're called, GLP drugs. Yep. Are you all seeing that yet? Is that changing people's lives?
It definitely impacted us because, being at the forefront of healthcare treatments and, focusing on diabetes and obesity, we are very active in clinical trials and trying to see what's the new thing coming and how can we implement it. So I'm actually a patient at LifeDoc, and I've been on Ozempic for 6 years.
Oh, wow. Okay.
And so it was interesting to see when, it ran out and a lot of our patients weren't able to get it because, people stampeded to their primary cares to get Ozempic. It's more being used as a weight loss drug instead of, actually treating some of the things it had been known to do because, it does have that side effect where it suppresses appetite.
Yeah.
Personally, I would rather, medicine be used to prevent than it is to treat. Yeah. So, if supply weren't an issue, I'd rather pharmaceutical companies be able to make money by keeping people healthy and keeping them from developing diabetes, hypertension, and all those things that develop. Right. But, we were definitely impacted.
And again, I haven't listened to a ton about this or read a ton about it, but I've read enough and listened to enough that, it does right now because it became known as this weight loss drug, and it's very expensive and it's in short supply, but that if the supply and cost issues get worked out, it has an incredible potential to change obesity in the country. And particularly obesity it's not just the poor, but it tends to be concentrated in lower income people, and it could change people's lives.
And so if anybody were to go to our website, there's a little tab that says publications because we are a research organization. And so we publish a lot of what we find. And you'll see GLP-1 and other sort of treatment approaches be a part of those things. Because as healthcare becomes more informed, as you learn more about what's going on in the communities of different demographics, what treatments work and what are the side effects. Yeah, I mean, it's pretty revolutionary not having to just depend on insulin, which has its own side effects. It's still new. And so obviously, like anything that's new, we have yet to learn more about long-term effects. My ideal scenario is that the people that do use it to get back, sort of to an ideal weight or to an ideal status quo for their body and get off of it and stay on it without medication. That's the ideal, scenario.
Right. You all are part of the Northside development. What was the Northside High and is now Northside Square. Did I say that correctly? What's the new name? Is it Northside?
So it was Northside High, and it was actually a really cool development that we were approached by the Works to be a part of.
Talk a little bit for those who don't know. The old Northside High in North Memphis. Rashawn Austin from the Works, Archie Willis, who's done a tremendous amount of development and redevelopment in Memphis. Full disclosure, Rashawn is also a board member of the Daily Memphian. We've done behind the headline shows and we've written about it a lot in the Daily Memphian, but it's an incredible $70+ million project. People rightly somewhat, shorthanded as a kind of smaller but still very large scale crosstown type where a whole lot of different entities are coming in there. So you all are going to be playing a role in terms of providing medical services to the neighborhood and to people who are there?
So a lot of what we focused on, is how can we be accessible and provide equitable access to care? So even though all our locations see anybody that'll walk through the door, we are going to Northside because that is one of the most health disparate communities in Memphis. And so a lot of what we're going to do is be part of this multi-use facility that has affordable housing, career development opportunities with Mecca at Code Crew, the Goodwill Learning Center, More Tech is going to be there. And these are all folks that we already have relationships with. And so it's really exciting to be able to be in the same location in a place where it's going to be very synergistic approach to helping each other, but also helping the community that we're involved with. And the grand opening of Northside was one of the most inspiring ones that I'd ever gone to because the whole community was involved. There was people that had lived there for generations that were out there excited about what's coming their way. So it was really cool. And we're very lucky to be part of that opportunity.
And I can't remember the projected opening date is something
right now we're looking at Q3 2025. And, Archie and Rashawn will forgive me if that is not correct. But we're planning on our end for Q3 2025. We're already staffing, training the providers that are going to be out there, preparing to, to go in that direction.
I was going to ask you about staffing. Staffing in the medical community has been very hard for many, many years. Shortage of doctors, shortage of nurses, and so on. Then COVID happened and made everything certainly worse during COVID for obvious reasons. But how much do you all just struggle with that challenge that all medical entities, employers of medical professionals, that they deal with?
So you said it right. Something that was already a problem definitely got exacerbated after COVID, right? Because people were burnt out, they were changing industries, and the people that remained, were also changing the dynamic. Most people wanted to go to the hospital or become travel nurses, And so preventive care for the underserved population wasn't at the top of the list of a lot of people's priorities. And so since we also have the added challenge that 60% of our patients are Spanish speaking. Okay. And so 80% of our staff is bilingual.
Oh, wow.
And so we have to make sure that we're staffing appropriately for the communities that we're serving. And so finding bilingual candidates that were passionate about what we're passionate about and that have the resilience to serve the underserved, because a lot of people sometimes have that idea of, oh, hey, I want to make a difference. Sure. But then, they sometimes realize that the work is harder than, what they may have imagined. So by doing what we do, we're trying to make it easier for others to replicate. and how can we help guide this to be, you know, the standard of care everywhere else.
About how many staff do you employ?
Altogether, we're close to 94 currently, with 20 open positions to scale into the clinic we just opened, as well as North Side next year.
Yeah. About what the ratio of doctors, nurses, staff, I'm just curious, you know, how that all works.
So we have, between all the schedules that include doctors, nurses, techs, and all those things, we have about 30 schedules.
Okay.
But we have about 16 providers. So, you know, people that do the office visits with the patients is about 16. We treat 12,000 Memphians.
Yeah.
Provide about 50,000 visits a year, because our concept is, you know, follow-up. Our model focuses a lot on care coordination and integration. So once we know what's going on with you, we call you and try to make sure that healthcare is prioritized in your life, because that's a challenge, especially when you start talking about different zip codes of Memphis, and can they actually prioritize and do something about their healthcare status?
Well, and it's got to be a huge challenge to get people to their appointments, just because we don't have great mass transit. I mean, we're a very car-dependent city. You've got people maybe they don't have child care. I mean, it's just a tremendous challenge, I would imagine.
It's one of the many, you know, one of the hot topics right now in healthcare for the last few years has been the term social determinants of health, right? Social risk factors is what we call them, but that's the idea that most of your health is determined by the things that go on outside of the clinic, right? The NIH and the CDC and the World Health Organization all published that only 15% of your health is determined by the care you receive. 25% is genetics, and the other 60% is where do you live, work, and play. And so because Memphians have very different realities of where they live, work, and play, then they also have drastically different health outcomes when it comes down to knowing what's going on and what can they do about it.
Again, talking to Pedro Velasquez from LifeDoc. If, 5, 6, 7 years down the road, I don't know how far ahead you guys sort of plan and strategic plan, where would you like to see LifeDoc? I mean, how serving more people, more locations, more, maybe not? I mean, what would be the 5-year plus vision for LifeDoc?
So our vision is more around being the reference model. So that's why we invest so much in research and publishing and policy work, because we want to make sure that if we find what works for the most amount of people, how can we make this available and implementable by others? So systemic change for healthcare outcomes requires more than just the healthcare system. People need to change the food industry, the transportation industry. Bandwidth across Memphis has to be more accessible for remote work and telemedicine. You know, all these socioeconomic factors need to be influenced, and our approach is going to be on what role can the healthcare budget and healthcare industry have in developing these systemic changes. And so 5 years down the road, I would love to see where, you know, access to healthy living is better in the communities that we're trying to influence, I guess.
But more, if I understood you right, more in the sort of laying out best practices, laying out reference, laying out research than you yourselves getting so big that you're trying to tackle every patient in every neighborhood and problem. We
do an approach not to sound, not to compare ourselves, but, you know, St. Jude from Memphis has influenced the whole world, right? They have a global footprint because they find the treatments that work and then they share and help others implement it. We're doing a similar approach for preventive care. We want to find what works because the best treatment is prevention. And we want to see what has to happen so that people don't have to visit the doctor 12 times a year to be healthy. That should be natural, you know. I mentioned earlier that I love traveling, and I've been to countries poorer than the US that have healthier populations. And lifestyle has a lot to do with that. So healthy living is our goal. Building healthier communities and a healthy population is our goal, not necessarily just treating people for diabetes and obesity. Yeah, that whole notion. I mean, I remember, anyway, yes, the whole, I was going to go back to Obamacare. Now that Van Gundy's laughing at me, but I remember all these seminars we did when Obamacare was coming along, these business seminars and all these shows and all this of just getting people to, I mean, whatever you thought about it, the part of the whole conversation was about we're so reactive, right? We react to people being sick versus, you know, I mean, I was talking to my kids who are 24-ish, 25, about the things that you can now get for free, right? I mean, you can get
all kinds of treatments for free or preventative care for free that you used to have to pay for, which is they were sort of blown away by that concept that you'd have to pay for a colonoscopy, or you'd have to pay for, all kinds of things that now are by law free. So,
well, and free for many, but Memphis is still one of the spots that has more than 20% uninsured population.
Fair enough.
And
yes.
So, whether it's the working poor, they count on organizations like Church Health and, LifeDoc, because we also provide a solution where they become a member of the clinic and they get access to everything we do for 90% off. And so how can we, when we talk about health equity and access to care for all spectrums, it's actually that. And doing it sustainably where it doesn't depend on donations and grants is a challenge. But it's a challenge that we're taking on so that others don't have to.
Okay. You came here, again, you mentioned being here in St. Jude. How old were you when you came to Memphis?
So I was diagnosed when I was 5 years old, almost 6. We landed in Memphis in the spring of 1997.
Okay.
We're planning to go back 2.5 years later when I was in remission, but had a relapse. And, that's when we stayed. Yeah. My father, who I had mentioned, was a endocrinologist. He wasn't licensed to practice in the U.S., so he was working at UT as a research assistant, going from being a physician to making $20 an hour again for 3 years isn't an easy blow to take. So, but it was something that was doable because of Memphis. When we landed, we stayed at the Ronald McDonald House. There was a church that when we got our first apartment that was subsidized by St. Jude, there was a church that donated our furniture, our cooking utensils, everything. So, again, that's what sort of instigated why are we still here? And why are we driven to do what we're doing?
Again, Pedro Velasquez from LifeDoc. Last question I always ask people, what was the first concert you ever saw?
The first concert I ever saw, I've seen 4 concerts in my life. I love live music venues. I'll go to live music venues, but concerts, like bars, that's my jam. But my first concert I ever saw was at the FedEx Forum, and it was Lil Wayne.
Oh, wow. That's nice. That's a first, I think. I think it's a first.
It was in high school.
Yeah, that's very good. Well, people can learn more if they look up LifeDoc. Thanks so much for being here. We really appreciate it. That is all the time we have this week, though. If you missed any of the show today, you can get the full episode online at WYXR, or you can get it at Daily Memphian, or wherever you get your podcasts. The Sidebar airs on WYXR 91.7 every Thursday at 11:30. Subscribe to this podcast and our other Daily Memphian podcasts, wherever you get your podcasts. Thanks very much, and we'll see you next week.